Thank you, Dr. Koroshetz. You may have joined this convening because the National Forum promised that practitioners who are successful in blood pressure control will share the secrets of their success. That is where we turn now. The Executive Director of Million Hearts, Dr. Larry Sperling, will talk with two practice leaders from a Million Hearts hypertension control champion, the Center Siouxland Community Health Center in eastern Nebraska and western Iowa. Dave Faldmo is a physician assistant and the quality director and medical director at the Federally Qualified Health Center. Erin Hofling is a nurse and quality specialist in the practice. Dr. Sperling?
Hello, I'm Dr. Larry Sperling. I'm the Executive Director of the Million Hearts Initiative. On behalf of our team and the Million Hearts partners across our country, I am glad to introduce the Million Hearts Hypertension Control Champion Program and highlight one of our national champions. Today's Million Hearts Hypertension Control Champion is a community health center who achieved blood pressure control for at least 80% of their adult patients with hypertension in 2019 and submitted their application in the spring of 2020. Million Hearts recognized a total of 15 champions in 2020. In total, they cared for more than 200,000 patients. I'm honored to be joined today by the Siouxland Community Health Center. I'll be speaking with David Faldmo, Quality Director and Medical Director, and Erin Hofling, who's a quality specialist. Thank you both for joining us today.
We're glad to be here.
Yeah, wonderful. Thank you. And I wish we could be in person, hopefully 2022. We'd like to hear a little bit more about the great work that you all have been doing, a little bit more about your hypertension control achievements and the strategies that have worked for you. So I'm going to take you through a couple of questions, and really this is just a great opportunity to highlight your commitment and the work of your teams on behalf of the communities that you serve. As a federal nonprofit, as a nonprofit federally qualified health center, what's worked best for controlling hypertension?
Well, I think our approach is that we need to know who's in charge of the patient, who's the assigned primary care provider, and provide that primary care provider's team with the tools they need to be successful in monitoring those patients with hypertension. And so we've worked really hard over the years, and our quality programs matured and developed over the past 10 years. And we really are at a point now where I think the teams feel supported by the organization to have the tools and the ability to really use population health as a way to make sure every patient's watched after and cared for. So I think that's really been the key. And Erin, as our quality specialist, has played a key role in that, and she helps us organize all those efforts that we're doing right now.
Maybe tell us a little bit of background about your team there and the community that you serve.
So we are in Sioux City, Iowa. We have two clinics. One's in Sioux City, one's in South Sioux City, Nebraska, but we serve that tri-state area, so South Dakota, Iowa, and Nebraska. And we're really a blue-collar town. We have a lot of meat processing plants here in the area. And so many of our patients come from that occupation. And because of that, we have many immigrant populations. We have many Hispanic, Spanish-speaking patients. We have a large Somali population here in our area. We have a lot of Southeast Asians. And so we have a really a variety of different ethnicities and cultures that come in. And it's one of the great things that I think about working here is that we have such a variety of patients that we deal with. But because of that, they need sometimes a little bit of extra help. We have full-time Spanish and Vietnamese interpreters. We have Somali interpreters. We have different resources to help give culturally sensitive care. And as far as some of the other things that we've set up, and I'll let Erin speak to that a little bit about how we work with the teams in assisting them in managing their patients with hypertension.
Yeah. I'm interested to hear a little bit more about that, Erin. In your application, it was stated that evidence-based hypertension protocols have been developed for your clinical teams there and wanted to understand the protocols that you've been working on and, of course, the outcomes that you've been able to achieve.
And Aaron, maybe you could touch on the audits that we do using the protocol as a basis of the peer review audits.
Yeah, so we do peer review audits quarterly, and we grab from different comorbidities, and one of them is hypertension. They have a workflow that they kind of follow. Is the blood pressure this? If it's high, are these medications being used? Is the medication or is the blood pressure being rechecked during the visit? Let's see, were there adjustments made in the treatment if it was high, and was the patient scheduled for follow-up at the appropriate interval that's been determined? And usually that's 4 to 6 weeks or 2 to 4 weeks if high.
I know you also noted that a team approach is used to drive your quality work. How has that team approach helped to facilitate becoming a Million Hearts hypertension control champion?
So Aaron will meet with each provider and his or her nursing staff, but we also have RN health coaches and behavioral health case managers that join that quality huddle for each provider. And they're able to receive a list of patients that aren't meeting goal for the blood pressure measure. And with that list, it also lists their last visit, when it was, what their blood pressure was when they were last seen, do they have a follow-up appointment, it has their phone number. And so that has been very useful. So then after that quality huddle that occurs about every 2 months, that team has that list. And when they maybe have some downtime, maybe their providers out of the office one day, the nursing staff can use that list to call patients, make sure they have appointments, see how they're doing. Our RN health coaches are available on the spot when patients are in the office. If we need to do some education on a DASH diet, they can go in and give a patient a American Heart Association printout of what a DASH diet really is and give them oral instruction on that as well. And then, as we know, many of our patients have different barriers to lifestyle modifications, and all of our health coaches and behavioral health case managers have training in motivational interviewing. And I think that's real valuable in helping patients set self-management goals and overcoming maybe some mental blocks and doing what they really need to do to make those lifestyle changes to help address their blood pressure issue.
Well, this has been, as you all know, a very challenging year for those of us who serve in healthcare and public health and serve communities like you do there in Iowa and Nebraska. During the past year, what have you all been able to do to keep your practices focused on controlling hypertension and making sure that cardiovascular disease prevention remains a priority?
So as you mentioned, it's been very, very difficult, and our area was really hit hard due to the occupations that many of our patients are employed in. And so for a while, we were really shut down to patients, and we had parking lot clinics. We created a drive-through testing site for COVID testing. And of course, when we were seeing patients in the parking lot, we weren't taking blood pressures. We were checking a pulse ox and a temperature. And we had so many patients that just did not feel comfortable coming into the office anymore. And so, we did start telehealth. And fortunately, a couple of years ago, we participated in an Iowa Medicaid blood pressure project that allowed us to provide home blood pressure cuffs for many of our patients. Not everyone, but some of them were able to monitor their blood pressure at home. And so when we would call them for a telehealth visit or do a telehealth visit with the tool we use to have the audio and the visual together, they were able to tell us what their blood pressure was at home, and that's helpful. But many of them didn't. We would ask them, are you having chest pain, headaches, ankle swelling, any palpitations? But we really couldn't assess where their blood pressure was at that time. So just now, some of our patients are just now coming back into the office for the first time in over a year, and many of them are not under control and probably have not been over the last few months. And so that's been really difficult, but we've really done our best to when we've had these televisits is trying to find out if maybe they can purchase a home blood pressure cuff to start monitoring at home and try to make sure they're getting vaccinated so they will feel comfortable coming in for a face-to-face visit so we can properly assess their blood pressure in the office. But it has been difficult. But the nice thing about the system we have set up is at these quality huddles, we know who's not been in and who's on the high list right now. And we can really work that list to make sure that we're reaching out to make sure they have appointments and we can get them in to really assess them. It's now the numbers are going down with COVID and many are more comfortable coming into the office.
So it does sound like with your population health approach that you've been able to identify some higher risk individuals and reach out to them in a proactive fashion, which is really wonderful. You talked about the parking lot, visits when things were shut down. Any sense of the telemedicine visits, the percent of those you all were doing at some point, and where are you right now, and how are you trying to incorporate hypertension control and a checklist of some of the protocols you might use in the office through telemedicine?
Yeah, it's been difficult, and it's certainly not optimal to assess someone's blood pressure or hypertension control remotely. And so I think our main focus now is getting people back in the office and knowing that, we did the best we could with telehealth, but it's time to get them back in the office and provide a safe environment that they can come in and be seen and make sure they feel comfortable with that. And so that's really our focus right now.
Well, any last comments you want to share with the National Forum? And again, just thank you so much for joining us today for this conversation, but also on behalf of those on your team. It sounds like you're committed to the great work that you do, even in the midst of our current really continued challenges each day. My strategy has been just take one day at a time. I think that's all we can do. But any last comments you want to make? And again, thanks from the bottom of my heart. A million thanks for being a Million Hearts Hypertension Control Champion. You've taught many around the country about what it is to be a best practice. Any final comments?
I think an important area is the quality huddles and the process that we do. And I think one thing that really helps that is in each of those quality huddles, the provider team, the case manager, the health coaches, we do a PDSA, a Plan, Do, Study, Act. So we'll look at their numbers for hypertension and how can we improve that in the next 2 months. And then we come back and we reevaluate that situation. And I think that gives the teams accountability because they really want to get that number. They want to reach the goal that they set. And if we don't reach it, we kind of make modifications. Are we going to be more aggressive in our patient call reminders or calling patients before their appointments to take their medication? I think that's been huge in the process of our quality huddles.
And I would just add too that every team knows how they're performing. And so we provide a monthly scorecard on different quality measures of emphasis, and blood pressure being one of them. And they can see how everyone else is doing and how they are doing. And so it's displayed publicly back in the workstations. Everyone can see them, everyone can see how they're doing. And for each team, we also give them a look back 12 months, each month, how they're doing. Are they getting better? Are they declining a little bit? And so, and it's not really to shame anyone, but everyone's competitive, I think. Most people are anyway. And so I think just knowing how you're performing, no one wants to be last on that list. And so everyone works a little bit harder, and that's worked really well. The other thing is just have standardized workflows on how to properly check a blood pressure. And so every year, all the nurses have to go through a competency testing. And that's one of the stations, how to properly take a blood pressure. So that's one thing. And then just little things like, what if someone missed their last appointment and is calling for a blood pressure refill on their medicine? Sometimes we'll give them enough, we'll give them an appointment and give them enough to get through to that appointment. If they miss that appointment, we'll set another appointment and give them just enough to get to that next appointment. So little things like that, I think over the years, teams have learned what's the best way to help people be compliant and with our recommendations and teaching them lifestyle modifications that are helpful, so we're not only relying on medications as well. We do our best to provide fresh produce for our patients during the summer months with a collaboration we have with a program called Voices for Food, where we actually have fresh produce in our lobby that anyone can access. So if we're talking to them about a DASH diet, some of them say, I can't afford that type of a diet. but we do all we can to help them with that, overcome that barrier by providing fresh produce. So there's just a lot of little things that we're doing over the years that I think now is really paying big benefits in making sure that we're doing the best we can in controlling blood pressure in our patient population.
Well, Dave and Aaron, thank you so much for joining us. I've really enjoyed personally learning about the work that you do and continue to do. Please extend our congratulations and our thanks to all that work with you there at the Siouxland Community Health Center, and wishing you all the best in the coming weeks, months, and year ahead.
Could I just add one more thing? I think having support at the top is crucial. So we have a chief medical officer and a CEO that are all for these quality huddles and allowing providers to be out of production for an hour to concentrate on their quality measures with their team. And so just having that support from the top is so crucial to have a successful program.
Thanks for adding that. So definitely the need for support, recognizing that quality makes a difference, and also it creates a team. It creates a team atmosphere and the right culture for success. Thanks to all of you, and really appreciate you joining us, and wishing you all the best. Keep up your great work, please.
Thank you very much.